Hi there, welcome to Dr. Chan's Minor Ailment Forum. Today I would like to talk about gout. My friend has been watching some of the videos and she said, well actually my husband suffers from gout. Could you tell me a bit more about this condition? I said, yeah, why not? Okay. So, well, do you know much about gout? You know, if I say the word gout, what does it make you think about? I think the first thing that comes up to my mind is the disease of the kings. Have you heard about this phrase before? The reason that people said gout is a posh disease or a disease that a king would get is because it was actually, you know, more common in people who were having a better lifestyle when they were in the ancient times. For example, the common one, it's suddenly turned into a history channel, but you know, it'll be interesting to talk about Henry VIII, you know, about his gout and whatnot. Reading through some of the documentation, apparently towards his later life, his waist was 54 inches wide. I can't even imagine how wide. And it was also covered in pus-filled boils, and they were thinking maybe these are all related to his diabetes and gout as well. So you can imagine, you know, why people said gout used to be a disease of the kings, because only if you were able to binge eat and binge drink, you might be able to get that disease in the ancient times. But obviously the world has changed now, and we all have relatively good diet and alcohol and rich food and stuff like that is easily accessible. So yeah, it's important to talk about the biochemistry of gout so we know what causes gout and how to avoid it in the future. So gout in its own is an inflammatory joint disease that some people said is more common at the big joints, big toe joints rather, but it's not necessarily true because it can happen at several different places at the same time. For example, your shoulders or your knees, but you know, I've seen people having gout in the spine as well. So the causing of this inflammation is having too much uric acid in your joints. So you can think about either someone is having too much intake of a food that produces uric acid that you can't get rid of it quick enough, or it could be your kidneys are not working so well to get rid of it. So you can think about people who have a really good lifestyle, eat a lot of rich food or drink a lot of alcohol, they might run into trouble. Also people who drink a lot of fizzy drinks also could have gout as well down the line. And any food that's rich in purines, for example cheese, pickled food or liver and stuff like that, they all can cause you to have a high uric acid in the system as well. So we, you know, ought to look into the kind of food that we eat in order to reduce the chance of getting gout. And sometimes some people might say, well look, I eat really healthily, I don't even touch any red meat or cheese or alcohol, but why do I get gout? Well, some medication can actually cause gout, and the common one are, for example, aspirin, and also some water tablets for high blood pressure, for example, benzoylflumethiazide. So in those sort of cases, it's kind of hard to avoid getting gout. But it doesn't mean that you're definitely going to get it, and we always recommend, you know, drink plenty to make sure. Now we'd like to talk about how we actually diagnose gout and what is the treatment options. So let's talk about the diagnosis first. So the most common thing is, you know, if you present with a red hot painful joint, especially at the big toe, you're probably going to be gout, although there are other things, for example cellulitis and stuff like that, but being seen by a doctor is important for us to diagnose whether it could be gout or not. And there's also blood tests that you can do to you know, confirm, you know, your gout and how bad it is. Basically it's checking the uric acid level in your body. The thing is, while you're actively having gout attacks, it's really difficult to kind of confirm the urate level inside the body, because while you're actually having an attack, the uric acid is staying inside your joints. So when you do a blood test, it might be abnormally low, or it might just be normal, because all the uric acids are staying inside the joint. So I always advise my patient to have the blood test maybe 2 to 3 weeks after the first attack, when the pain is getting a little bit better, so we can get a general idea of how much uric acid you've got inside your body. And let's just say if you have gout more than twice a year, I would recommend you to be on a medication called allopurinol to prevent a further gout attack. And this medication is very useful, but we don't recommend you to take it while you are actively having an attack of gout. Saying that, if you're already on this medication and you have another gout attack, if it's okay to continue taking it. And also, if, for example, you present to a GP saying that you've got painful joint and you've been diagnosed with gout, what other medication can be provided for you? Main treatment is pain control and anti-inflammatory. Some people are not suitable to take anti-inflammatory. For example, they're on warfarin, or they're actually allergic to anti-inflammatories like ibuprofen or diclofenac, that kind of medication. Then there's a medication called colchicine that you can try, but there's a joke about this medication is you can run before you walk, because normally after a few days. Okay, so bottom line is gout is extremely common, and you don't have to be a king to get it. However, the good news is it's easily treatable, especially if you look into your diet first. And if you suspect that you might have gout, or your friends might have got gout, make sure that you recommend your friends and family to go and see your GP, because although it's not life-threatening, but if you get a lot of attacks of gout, eventually they might have some joint damage into the area, so you don't really want that. So I hope that this video is useful for you, and please come back to my website and have a look at other videos, because they're quite informative as well. Take care for now. Bye bye.